that set up. All right. Thank you everyone for being here. My name is Stephen Stott. My pronouns are he and him, and I work in the training department here at Crisis Connections. Here you are attending the Crisis Connections Suicide Prevention with Students webinar. We have 5 panelists that are here today. So I am actually going to stop sharing to spotlight myself so you can see who I am. And again, I am extremely appreciative of all of you being here and your commitments and dedication to the health and well-being of your students. We'd like to acknowledge the Washington State Hospital Association, and thanks to them and their grant that we received in 2020, we have been able to provide trainings for last year for suicide prevention with students, and they are the ones who are funding this webinar that we are recording so that people can watch in the future. I would like to take a quick moment and I want us to center and ground ourselves so that we can remember those who have died by suicide. And in this moment of silence, I just ask that you think, breathe, be in tune with your bodies, and think about the ones who you would like to remember. And we will take a moment so that we can mourn together. All right, if you haven't already, take a deep breath. We are here till 11:30. We're going to listen to our panelists to see what they're doing with suicide prevention with their students and in their community. And again, our focus here with Crisis Connections is how can we connect people? How can we collaborate? How can we work together? How can we relieve some of this burden that we might feel in our communities if you might be the only person doing this work? Or if there are a small number of you, again, how can we create a larger and stronger support network for our youth and students so that when they're in crisis, when they're overwhelmed, when they're anxious, what can we do to help them, their families, as well as how can we help and support ourselves? Because if we can't take care of ourselves, everyone has heard this before, how are we going to take care of our students and youth? I want to take a quick moment to talk a little bit about the services that we have here at Crisis Connections. We are located again in King County. We have 3 statewide programs. We have the Warm Line. This is a non-crisis line for adults who are looking for emotional or mental health support. There is also a veteran specialist. That is a program through the Warm Line. So if you work with veterans and they just want some emotional or mental health support and they want to talk with another veteran, again, that's what the line is for. If they don't want to talk to a veteran, they can speak with a specialist on the Warm Line. We also have the Washington Recovery Helpline. This is a program for people who want some support with substance use and addictions. If you know someone who is struggling with substance use and addictions, you can call for support for yourself or for resources for them. If you are a person who is struggling with substance use and addictions, you can call for support for yourselves or to get help in locating what resources and treatments available in your area. We also have TeenLink. So as you work with students, TeenLink is a statewide program for calling, texting, or messaging. So if teens want to talk with another teen, they can call TeenLink. If parents are looking for support around substance use with their teens, or again, if you're an adult who is working with a youth or teen, you can call TeenLink because there is also a substance use disorder clinician who is available Monday to Friday to provide support to you. Or if the teen themselves is wanting information on substance use and what the impact is on their body, they can call and speak with the clinician themselves to get that support. We also have survivors of suicide loss support services. We have a free suicide loss support group that meets the first and third Monday of the month. And we also have a mentor program and a care package. So if you know of, or if you are a suicide loss survivor, you can reach out to that program and they can connect you with another suicide loss survivor for a companion mentor, or we can also send out a care package that has some supports on suicide loss grief, as well as some coping skills and additional information. If you would like to reach out, I will put some links in the chat so that you can check out these programs. And let's jump in. I am going to introduce our first panelist. Her name is Alanna McCorkle. She is the Dean of Students at Federal Way Public School District in King County. Previous to this position, she worked in health education in Seattle Public Schools, and she had Crisis Connections come to her classroom where we talked about peer-to-peer suicide prevention with her students. Like all of you here today, she is committed and dedicated to the health and well-being of her students.
Hi, good to see you guys, and thanks for being here. I'm just going to talk a little bit about my journey to reaching out to Crisis Connections this year and getting them into our school here. I'm at Taffet-Sahaly 6 through 12 STEM school, and we at Federal Way Public Schools this year have dedicated time to social emotional learning that I'm working with our teachers to provide resources and coach to teach those 30-minute lessons dedicated 4 days a week for our students. I worked with TeenLink in Seattle Public Schools in my health classrooms, like Stephen said, and they were just such a great resource for my kids as we did our mental health unit. We talked about mental health disorders, destigmatizing, normalizing, reaching out to a counselor. They came into the classroom and just really backed up those lessons and provided another resource for students to reach out to if they were in crisis or if they just needed to talk. And the lessons were really great. They made connections with my students, and I thought it was so valuable. So this year, as we went into remote learning and we were talking about that students were going to be possibly experiencing a lot more issues with depression, with anxiety, with risk for self-harm, with risk for suicidality, that's who came to mind. And as I thought, who can support at our schools as we go into this, and as teachers need more support in teaching social emotional learning. So I actually reached out to Crisis Connections and said, hey, how can we get you guys to our schools? And we talked about that they did come into health classrooms. My concern was that not all of our students at our school are taking health right now. And so they would reach this small pocket of students that were in health, and it wouldn't make a big enough impact on our school. So I asked them to come to a teacher professional development to present and talk about what they would be presenting to our classrooms, and to modify the lesson to come into that social emotional learning time so that all of our students could have access to the information. And the specific thing that led me to them, beyond just talking about that students would possibly be experiencing a lot more issues with anxiety or depression or just needing that extra support, was there a specific event where we got information about a conversation that students were having with one another, where one of the students was telling another student that they were having suicidal ideations, and it was me and the counselor who needed to reach out and support both of those students. And I thought, the student who was hearing this information didn't know what to do with it. So we needed to provide support for him around what do I do when I hear that my friend is experiencing this? So I worked with Crisis Connections to come in. They came to a teacher professional development, so all staff was there, and just talked about what they would be doing. if they came to social emotional learning time. And then we provided the information for them to schedule the lessons. It didn't happen right away, so I was all stoked, like, oh, they're all gonna be scheduling these lessons, but our teachers are extremely busy in planning all of their lessons. So we ended up providing them time during one of our leadership meetings to go ahead and send that email and get the lesson scheduled. And then it started rolling. They came to our classroom, our virtual classrooms, and did the 30-minute lesson. And I was there to support, a counselor was there to support. So we all kind of did wraparound. And we were so thankful that we all did. As they were there, our kids, our scholars' cameras that started popping on that we hadn't seen come on, and they were sharing things that our teachers didn't know that the students would be open to sharing. So they were opening up and sharing some of their experiences that were heavy and hard sometimes for the teacher to hear and know what to do with, but gave us the opportunity to know which kids needed support. We were able to start a small group with some of the students who needed extra support. And it just like got those social emotional learning lessons really rolling in the direction that we wanted them to go. And it was just this opener that provided that, as well as provided support for students who either might have had suicidal ideations themselves, or had a friend who did, or a family member. So I was just very thankful that they came, that they connected with our students, and that they were able to open up those doors for us and for our teachers, and to talk about something that a lot of people are afraid to talk about, but we need to be talking about with our kids. So we have continued our partnership and are talking about creating a community partner relationship with our school district, and how to do that with other districts. So I'm looking forward to continued partnership with Crisis Connections, and being able to just open up relationships for our teachers and our students, so that we have a window in to know when our students need support, and that we're not having to find that out secondhand through someone heard that someone said this, or that it popped up on an email conversation, that we can get on that prevention end and before things go further than we hope that they'll go. So that has been our journey so far. I think that we're kind of in the beginning stages of getting those lessons going and getting it to all students, but I'm looking forward to continuing to build that.
All right, thanks, Alana, for giving us that information. And again, for everyone that's here, that's kind of what our aim is for, is how can we, as a state, connect with each other to collaborate so that people are doing the same thing. So that if a student is thinking about suicide and they talk with the teacher, and they talk with the parent, or they talk with the coach, or they talk with the therapist, or they go to the hospital, it's kind of the same language. What would that look like if we normalized and destigmatized talking about suicide, being direct, and also being prepared? So as a professional myself, I am a trained social worker. I graduated in 2014. I worked for a national nonprofit with grief and loss in the military population. And I can be honest in saying that when someone that I knew something was up, red flags were going, I didn't ask about suicide, even though in the back of my head, I'm like, I'm a social worker. I was trained in the assist, and I was like scared myself. So I know that this is something that we have to be prepared for. We have to train for it. We have to educate ourselves, and we also have to support each other. It's a scary topic. It's scary for us. It's scary for them. However, again, being prepared, being more trained, working together, collaborating and connecting, I feel that we can reduce some of that fear, some of that anxiety and stress and scariness, so that we can, again, build a support network where we can support our youth and students as well as ourselves. If you have any questions, I'm going to encourage you to either put them in the chat and or write them down. I would suggest writing them down because it might get lost in the chat. So after all of our panelists have gone, if you have any specific questions for the panelists, you can ask them, or if you have any general questions, you can ask them as well. And I also want to say that we're all humans, and as I've said, I've made mistakes myself. I should have asked Jennifer how to pronounce her last name, so I might say it wrong. So next we have Jennifer Neasley, the Interim Director of Teaching and Learning for Bainbridge School District in Kitsap County. She has worked as an assistant principal at Seattle Public Schools. After that, she was at principal in the Edmonds School District. From our chats, I can tell that she's a fierce advocate for her students around making sure that their needs are met, as well as putting up resources available to them, as well as supporting her staff and making sure that they are prepared. Jennifer, thank you so much for being here.
Thank you for having me. I have a line across my face. There I am. So you were close. When, as a principal, I was told my students, especially as assistant principal, that my last name is pronounced nicely instead of meanly. So that was really close. So I'm happy to be here. And yes, currently I am the interim director of teaching and learning for Bainbridge School District. And I haven't been a principal for the last 3 years because I decided to walk the talk with my family as my kids got ready to enter secondary. I really wanted to, and I'm fortunate to be able to just step back from that role to be able to be a parent first and to just kind of work with my kids through that transition. And so the role in Bainbridge is a part-time position, and so it allows me to still do both. So I'm home right now and with my kids today. So I just wanted to just talk about just a little bit about an incident that happened in November. So I will start there that I was a first responder to our neighbor boy who died by suicide, and as a former principal and just in so many different ways, it shook me to the core. And I was like, okay, I need to really take time and process what happened, process and figure out like, what are the support systems I need to put in place for my family and for the young man's family. And then once I kind of got regrounded in, I was like, I will, in honor of this young man, I will do whatever I can to leverage forward any resources that I have or knowledge in any way. And so being a member of the Bainbridge School District, we were already working on an implementation plan for signs of suicide curriculum, which I was familiar with in the Edmonds School District. And but I started to just ask a lot more questions, like what do we do around suicide prevention in Bainbridge? And I was pleased to see a lot of work that had gone into and thoughtful plans. And you'll hear from Joanna after this, but she did work in Bainbridge and also helped put some of these plans together. But so we have a district policy that was written around suicide prevention, and I think it's a good one and a good model that really guides how important it is to be responsive to our students. And so that's policy number 2145. You can find that on our school district website. In addition to that, there was a board adopted suicide prevention protocol that we also have in place, and you can also find that on our website. And so we put in infrastructure. And then we adopted a curriculum, and we also use Crisis Connection as a supplemental curriculum already in our district. And so we put curriculum material in place. And when we do suicide prevention through signs of suicide, the curriculum as that goes out, Bainbridge does an amazing job of activating community support around that same time. And so we network and say at this point in time, this is when we will be talking to our students about suicide prevention and also what to do if you're concerned about yourself or others. And at that same time, we have mental health therapists ready and accessible, our counselors, our administrators. I mean, everybody, it's like all hands on deck as we roll out the curriculum. And on the days that we're not teaching the curriculum, we have protocol and process in place. If I put my principal hat on and I think about like what I did in my own schools, and one is that leading from the lens that it's my job to develop a school where every student has a sense of belonging and they know how much they matter. And so if you're leading from that lens, then you have to, you put on your equity hat and put on many different hats and think about like, what does that mean and what does that look like? And for me, it was making sure that we had social emotional learning as a component of both. I've been a principal of a middle school and a high school. And so social emotional learning curriculum, also restorative practices and community circle, and really thinking about how do we process when things don't go well, and how do we look at it from a lens of caring and not punitive punishment for students to create more harm that's unnecessary. Really understanding the impact of trauma and teaching our teachers, giving teachers access to information about trauma and ACE factors and how does that impact our students that we serve. And putting in place a place for identity development and creating classrooms where students and schools where students are allowed to be who they are, and it is okay, and that they can see themselves also in our staff. So in hiring practices and who I bring in and hire and who our students have exposure to. So I think that all of those are our responsibility in putting in and breaking down institutional structures that create more harm for our students. And so that's what I have to offer today. So thank you.
Great. Thanks, Jennifer. I appreciate you being here and all that you have done and all that you are doing. And again, I just wanted to mention, like I said earlier, that we were mourning together. And the reason why I say that is because I do come from a grief and loss background, and grieving, from my perspective, is something that we do individually, and mourning is something that we do together. So I want to take another moment, if people would like to honor anybody that has died by suicide, and put that in the chat. Please feel free to go ahead and do so that we can remember at least their names and that we can bring them to the forefront, because again, this is very important work that we all need to do. Suicide is complex, and a person who has thoughts of suicide needs a support network. A person who helps a person with having thoughts of suicide, we need a support network as well. So next, we are going to have Terry Mayo. She is the project coordinator for Native Connections Suicide Prevention for the Colville tribe members. The Colville Reservation spans 1.4 million acres, and she has been trained in a variety of different suicide prevention modalities to better support her community. The health and well-being of the Colville tribal members is of the utmost priority for the tribal leadership, and the most sacred trust of the membership can bestow upon the leadership of the tribal council. The health and wellness of tribal members encompass the mental, physical, emotional, and spiritual elements of life. The CCT Tribal Council are committed and invested in reducing health disparities by promoting a range of health services that incorporates Indigenous cultural modalities to best serve the tribal communities.
Thank you. That was great. Hi, everyone. My name is Terry Mayo. I am a Colville tribal member. Also, I've been in this position now since August 2017. It's a huge learning curve. My program functions off of a grant from SAMHSA, and its focus is around suicide prevention and substance abuse reduction. So a lot of the things, when I came in here, it was a pretty big learning curve. My background is human resources and administrator, and I do have a lot of experience with grants, and so I think that's why my boss pulled me in the way she did. Bless her heart. So around the first grant, so we're on our second grant. So our goals for the first grant that I want to talk about, because we still continue these, one of them is statistical information. This information is compiled working with our local schools as well as our local businesses within the communities, and also with our police department, the Cobble Tribal Police Department. What they do is I have a form that was developed, and what happens is I've dispersed these forms out to the local entities as well as the police department. And when there is an event that may have taken place, either death by suicide, suicidal behaviors, or ideations, what they do is they fill out the form, and I drive around. I know it's a lot of driving, but I drive around and I pick up these forms for the confidentiality reasons. We definitely don't want to breach. The other goal in this grant was community resource assessment. And what I do is, in our 4 communities, we have 4 of them: Interim, Keller, Nispelem, and Omak. Omak is our biggest district. And what we do with the CRAs, the community resource assessments, is that we do interviews with 8 community members, law enforcement, elders, things like that. And the interviews consist of like 4 dimensions: the leadership's knowledge, community's knowledge, and the community resources. And I can't remember the 4th one, but we do this, these dimensions, so that we can compile a strategic action plan of how we're going to do the implementations of all of this. The other goal was activities. And we do host a lot of activities so that there is more awareness. And going back to the CRA, what that does is that measures each of our communities' awareness about suicide. And when we first did it, our community members were at a 3.2. And since I had taken over the position, we finally got up to a 4.0. Yay! So we get to develop a strategic action plan around those. Some of the places that we do a lot of work is definitely within our schools. Now remember, we're surrounded by 3-4 counties. So we have Okanagan, which we are located. We have Ferry, we have Chelan, and Douglas. And so there are schools within those districts that have tribal members. And so what we try to do is make sure that we are hitting all the schools that do have tribal members. And it doesn't necessarily mean they have to be Colville. They can be a member of a different tribe as well. Some of the activities that we host with the communities, one is I do a community suicide awareness relay walk. I've had quite success with that. I didn't get to host it this year because of the pandemic, but I usually get over 200 participants. The last one was really cool. We had the Omak High School. It's a local school in the district where I live. And what they did is they came and they ran for 20 minutes straight in memory of someone that may have died by suicide or has suicide behaviors or ideations. It was pretty cool. The kids' dedication to that was pretty cool. Another one that I have is I have a 3-on-3 basketball tournament during our Omak Stampede celebration. And that's the second weekend in August. And it's probably the hottest time of the year. And just this past summer in 19, I had my first annual 3-on-3 basketball tournament, and I had over 40 teams, only 4 baskets to schedule these games around. And I did it all in one day. and of course, with the help of one of my staff members. And then we had volunteers, and the local businesses are really behind this. I had asked for some donations, like some door prizes and, some water, and I ended up getting over 50 flats of water. And I'll tell you what, these kids, they got it for free. The adults got it for free. And I probably, for the full day of Saturday, I had probably over 2,500 people there. And it was really cool because at the end of the day, and this is what I was going for, is less teenagers out and about to get themselves in trouble. So I was pretty successful with that. I was pretty happy because a lot of the parents came up and were pretty thankful for it, as well as I was, because we brought in teams from different communities as well, and it was really nice to see. Some of the other things that we do is we have collaborative partnerships with some of the local businesses, like with WorkSource, DSHS, our community action folks. And there's one other youth group that I'm a part of over here. And we have partnerships with these folks so that because they're the ones that provide a service for our tribal members. And so when they see that there may be something going on, of course, they know who to contact now, which is really nice because before nobody knew who to contact. So when we get into a situation where there may be an event, what takes place is that, of course, some of the folks get in contact with me, or the police department is the one that has to go in there and take care of the event. And then they're the ones that will send that information to me. I'm not a clinician. I am Terry Mayo with a master's degree in public administration with a focus in political science. So this is way kind of out of my element. And I let folks know that because I'm still on a learning curve because this is such a huge, I don't know if it's an issue, but it's huge. And so there's so many faucets that we have to tap into, and I'm still learning what those other faucets are. But these partnerships are important for my program, as well as the communication with our tribe. Some of the trainings, I do a lot of trainings. I'm certified in assist. I also do the mental health first aid for adults and youth. I'm trying to get my virtual certification on that and haven't had any luck. They're a little hard to get in touch with since everybody works remotely. I'm also certified in Safe Talk. Safe Talk is geared towards youth. When I did my training in 2019 for the Safe Talk, I had over 200 high school students participate. So it was actually quite successful, and it teaches the kids how to recognize some maybe suicide behaviors, or even the language, some of the kids use. So it's pretty cool. And one of the other things is that I try to do, and this is just on my own basis. I am a one staff member working in this program right now. And what I try to do is I try to have a working relationship, not only with the schools, but with parents that are heavily involved within our communities. And I've been able to establish about 4 in each of our districts. Of once in a while, I'll call up and, hey, how's it going? Have you heard anything? How are the kids? Because I can't be in every school. We have over 17 schools that surround our reservation. And a lot of these kids, our tribal members attend these schools. So that's some of the stuff that I do with our program here within the Cobble tribe. And it's pretty neat to do it. I also, Jan, she works, I can't remember what her title is, but we did 2 years in a row, I think it was, the Tribal Suicide Prevention Youth Summit. I believe that's what it was called. And so I was part of that planning committee, and it was pretty cool. We had some success with the students that came to the summit, and as well as the individuals that were doing the presentation. We had some pretty good talks. And a lot of this is geared around tribal because we have we're 10 times more at risk than any other race, which is unfortunate. Because within the boundaries of our reservation, we are at 18.46 suicides on an annual basis. And that's pretty high. That's what I have. Sorry.
No worries. Thank you so much, Terry. I appreciate all that you are doing. And again, as a reminder, that's why I wanted us to be here, because it breaks my heart to hear that you have to do this largely by yourself with such a large area. So again, I come from, even as a social work background, if you get rid of that, I am about people. How can we help each other? How can we support each other? How can we not be alone, right? So helping out Terry is something that Melissa and I definitely want to do. And in our communities in the state of Washington, Melissa and I are going to focus again on how can we make this more streamlined, where everyone is kind of doing the same thing or everyone's on the same page. And I'll have Melissa talk a little bit about that later after our last panelist. But next up, we have Joanna Rockwood. She is a school psychologist with the Edmonds School District in Snohomish County, where she is the suicide prevention and prepare leads for the crisis response team coordinator. She is also skilled in crisis management, suicide prevention, autism spectrum disorders, crisis intervention, elementary and secondary education, behavior specialist, as well as classroom management. Joanna, thank you for being here.
Thank you so much for inviting me. And yeah, Terry, my heart just goes out to you. And I just want to say I'm now going to talk about the exact polar opposite. What are our practices in a huge comprehensive 22 student district in the Edmonds School District? So yeah, for all of our panelists, thank you for being here and thank you for this incredible work. I have found myself here because it is a passion area for me, and I just continue to commit to showing up, and it just continues to grow, and the need unfortunately continues to grow. So in the Edmonds School District, we have we're fortunate enough to be able to we took our district policies based off of the OSPI and the model policy, which is the national best practices policies. And so we fashioned our district policies of prevention, intervention, and postventions off of that. And then we have since modified them for the virtual setting. And so we rolled that out as soon as we went into the remote learning in March. And then we also provide annual staff training, which we give resources. And one of the best resources, I think, as we're sharing resources out there, is OSPI has a free 1-hour training for teachers. It's called the CARE, C-A-R-E, and you can find it on their website. And they do a really good job for teachers in regards to how, what should you do if your students are talking about this? How can you approach it? And really, at the end of it all, their training is basically just listening. And then connecting them with resources. And then I also just happen to be one of the OSPI approved suicide prevention trainers for all school psychologists, school counselors, school social workers, and school nurses. And so that has allowed me to provide suicide prevention training all over the state, but also all over the nation, and then even most recently internationally. So I get to hear a lot of practices, and what we're doing here in Washington really kind of blows me away. We're doing some really great stuff here. And then in regards to kind of how do we address the mental health needs for our students in Edmonds, we have guidance lessons and an SEL curriculum, but more particular is the supports. And so we have family resource advocates, and we also have student support advocates in our buildings. And then we also have counselors and psychologists, but then we also contract with outside mental health providers to provide mental health services in our schools. And kind of make sure that that's happening. Of course, that's all teletherapy right now. But probably the biggest thing that we have done is we committed to starting off the year in crisis response. We're in the middle of a pandemic, which is a crisis. And so we decided to respond as appropriately. And so our entire district was trained in the psychological first aid for schools model. And we use that to plug into our students and to be able to support admin, staff, students, and families. And so that's our framework. We helped develop a framework in regards to over that as to how do we respond to this ongoing crisis. And then we continue to revisit it and update it as we continue to go through. And so that is probably our biggest kind of response tool that we've put in our toolkit so far this year. But listening to all of you, and actually just what I created yesterday was I pulled together a post-vention resource document. And Crisis Connection is one of the gold standards out there when it comes to post-vention supports. And so, I think sometimes we have our referral resource list that we hand out, which is great, but I wanted a post-vention resource document in regards to what do we do if we unfortunately deal with this particular crisis. So those are just kind of some every single year, and then every unfortunately single crisis response, we learn a little something new. We learn a little more. And so I so appreciate being able to be here and be a part of this ongoing conversation and to learn from everybody what they're doing too, because we're all in it for the right reasons, right? So how can we support this as we do this important work together? So thank you so much for letting me share.
All right, Joanna, thank you for sharing and all the work that you're doing as well. And last but not least, we have Dr. Julie Rickard. She is a founder of the North Central Washington Suicide Prevention Coalition, an expert in suicide prevention and healthcare consulting. And she also has a partnership with the schools to identify youth at risk. Like us, she believes in this collaborative process where we all come together to talk about suicide prevention, what we are doing, and how we can better support one another.
All right, well, thank you. I feel so inspired by this group of people. And Terry, I'm just impressed with some of the work that you've done on your own. So really great job. So I didn't come into suicide prevention with kind of this idea that I was like, oh yeah, I'm so passionate about this. And it was really kind of through happenstance. So I'm a clinical psychologist. My forte has always been kind of connecting mental health into medical types of settings. And, in those integrated models, what you see is the ripple effect of suicide. And what you often see is the families in crisis and the neighborhoods in crisis. And it just kind of started to wear on all of the clinicians that I supervised that there really wasn't a way to prevent it. We lived in this community, and you'd hear about the youth that were dying. We had several murder suicides that happened the year that I founded the coalition. We actually had 6 youth that died within the first 6 weeks of the year. And so it really was tragic. It was something that no one really knew what to do about it. And so I agreed to kind of step in and try to figure out how do we create some sort of prevention. And I don't know that I've done it correct, but it's kind of through an organic process that I've stayed with it. It's one of those things where like, once you're in it, how you let it go, it's just this feeling that it's just never done. So anyway, it's continued to grow. I have basically enlisted all of our community partners to sit on the coalition and to have representation on the coalition, because I feel strongly that I can have a meeting and I can share things, but really the truth is it takes the people that show up at the committee to take that information back to the leadership of the school, to the organization, and say, hey, here's things that maybe we could implement, or here's how we could do it with patients, here's how we could do it with students, and start to organically kind of spread that information just through a meeting. And so I've really worked on some of that. The other piece is that I have oftentimes, based on one of the things that I've done from the beginning, is collected coroner data. And I've kind of trained our local coroners to fill out my Excel sheet with all my boxes. And I want to know who they were, like, where did they work? Like, did they have a dog? Like, and they're like, so now they're so trained that when they have these conversations, I wonder if people tilt their head when they gather this. But the truth is that it has helped me tremendously, because what it shows is this process that, you know, depression, untreated depression, undertreated depression is one of the main factors year after year that continues to show up on our graph. Legal issues continues to show up on our graph. So what does that say about suicide prevention? It means that I need to be reaching some of the places where people are showing up in court, the juvenile justice. You know, when we have kids that are kind of struggling with drug and alcohol and we have multiple attempts, then it's partnering with the drug and alcohol centers. And so it's helped us shape our goals for every year, is looking at the past year's data and kind of what stood out. And so the last several years, we've had a lot of issues around youth suicide. This year, through the pandemic, our attempts for youth have gone up by 26%. And I think that's pretty high across the state. But I think getting those numbers out of our emergency room was like, you know, like what are we going to do? And then we did have a completion of a 17-year-old a few months into the pandemic, which we believe was COVID related. So it's one of those things where, you know, you start kind of hearing about data, but really data's our people, right? And so in this case, it's really a bigger deal. So one of the things that we did early on is I started pulling out and having focus groups or some work groups that would focus on specific topics. We did a teen focus group, which I have to tell you, I highly recommend it to every school, because you will be amazed at the information that we got out of that group. I mean, we met with these kids 3 times, and out of that information, what we learned was the things that we as adults are pushing on these kids as our safety plan were the things that they will never use. Like the crisis line, we say, oh, here's the crisis line, make sure it's in your phone. And what they say is, if I use that crisis line, I get bullied, I get teased, I get told I'm weak. And so I will never do that. If I get seen going into the counselor's office at the school, I get teased. I will not do it. I will go someplace else. I will go if a friend accompanies me. So they had all these rules that, you know, here as an adult and in suicide prevention, we're pushing all these things. And what we realize is at the youth level, they're meaningless. So until we align with our youth, which is why I think that Youth Summit, you know, is an amazing idea, because we really have to start at where the kids are at. And I think the other thing we do is we market to youth from an adult perspective, right? So we're not reaching the kids where they're at. I mean, what kid is sitting on the toilet reading a suicide prevention brochure, right? It ain't happening. But what is happening is that we had a death last year of a 15-year-old that put a video suicide message on a gaming channel, and not one adult, including the police, could access that stuff. And they had to go to the teens and say, would you give us access? Tell me where we're marketing in a gaming channel. It's not anywhere in my agenda. So it's those types of things. So I think we got that out of our teen focus group, which I thought was incredible. The other thing that we did was last year, pre-pandemic, so of course we have pre and post, right? So pre-pandemic, we agreed with the Wenatchee High School that we were going to screen all of the 9th graders coming into the school, and did use the patient health questionnaire, the PHQ-9. And in that, we had for 8 months planned this process going into kind of how are we going to do 550 students, and what's that going to look like, and how do we do that? So we had 4 different mental health agencies that gave us 3 clinicians each, so that if we got a positive score above, I think it was a 14 was our cutoff, then we could immediately triage those students into someone that could check them out and see if they were suicidal, see if what was the issue. And what we found was 26 students had scores that were high enough and concerning enough in that moment that we needed a direct intervention. 3 kids had plans for that week to kill themselves. 3 kids. And it was mind-blowing. And I think at the end of the day, the principals that were involved in the project, they were tearful and being like, I had no idea this was happening in our school. The other thing we caught were other things that were unrelated to suicide, but when you see them downstream, actually are completely related, right? Like eating disorders, abuse that's happening in the home, drugs that were happening, but they felt like they didn't have anybody to connect with to help them. And it was unbelievable. And then the other thing we learned was parents saying, you're not allowed to go to counseling. We don't do counseling, and the kids begging to see a counselor in the school that was not one of the school counselors, but an outside agency coming in. And so it was like, oh, well, we can, so we started kind of catching these kids that were asking for help in a different way. So that was an amazing project. And it highlighted it enough that the school agreed to sign on for the following year to start catching the kids. And in fact, then we extended it to the middle school 8th graders so that we could catch these kids coming into the high school in that transition period. But then COVID happened. So then we get into COVID, and right as we get into that, what happened was the schools were like, oh, we're into online learning. And so they just go in. Well, within the first few weeks of our school, in one of our schools, one of the kids had a gun that was sitting on a table behind them in the class, right? So they're in their Zoom room doing their thing, and the teacher can see a gun, has no idea what to do about the gun. Another kid comes online, puts a gun to their head. Another student has a gun, walks by the camera, but they can't identify the student. All things that at a district level, you've got to figure out how to manage. Like, what's the pathway to care? How do we reach these students? What's our protocol? And what should parents be doing? And what messaging should we be sending out, right? So those are all things that I got involved with in helping the schools kind of try to sort through, what do we do? How do we manage it? This is something we've never encountered. We've never had students in this way before. So teachers are uncomfortable. Like, if they can tell a student struggling in class, or they're not turning on their cameras, like, what are all the answers to that? When the youth died by suicide during this pandemic, it called to light the thing that the coalition had been pushing, which was that the schools needed to mandate cameras being on. And the schools were very reluctant at the beginning of things, but after that, they changed it district-wide, and then the cameras got turned on. But it's a strong belief that these kids are isolated in a home, and if they have a dysfunctional home, they have other things happening. What happens is now look around at this webinar right now. I see about 10 people that have their cameras on. Everybody else is a black screen with a name. That, at the end of the day, after I have seen back-to-back people, it feels like I'm alone in my world. And kids that already feel that way, we know a depressed brain views the world like they're alone anyway, even if they're in a group. So imagine a camera, you're just that much more separated. So I was happy that the school changed that and they kind of got on board with it. The other thing that we did was work with, we had 3 middle schools that we had been working with, doing kind of the extension of the high school project of a check-in process. So we used the first 2 questions from the PHQ, which were little interest or pleasure in doing things, feeling down, depressed, or hopeless. And those 2 questions are validated questions that if you only give those 2 questions, now, if you listen to those questions, they're really benign questions, right? They don't require any follow-up. They don't require, even if someone says, oh yeah, I have little interest or pleasure in doing things, while it's significant, it's not like it's a crisis. So it doesn't put any additional liability on people, but because it's a validated measure, what happens is if someone scores a 4 between those 2 questions, right? So highest is a 6 on both questions, 3 on each. A 4 predicts 45% will have the probability of having a major depressive disorder, or 81% that they'll have any depressive disorder. So just a score of 4. So the district put kind of in those 3 schools, they put a cutoff of 4 on that, and any kid that scored 4 or higher on those 2 questions in kind of a general check-in process would get a call, an email, get some sort of process related to connection. And so what they learned was we did a test pilot of one class, and we just did this screener. And what they learned out of that, and what we learned, was that we couldn't connect with the students, that the students didn't answer their email. They weren't responding to the way the school had set up to connect with them. So all of a sudden we sent the school officers to their house, and then they would have a conversation and then find out things. And so what we learned was that we needed to set up a more fluid pathway to reach these students that were unreachable, which was why we weren't asking about suicide, but we're also downstream. So now we get to ask these questions, which depression, the higher the depressed score, the more likely they are to be thinking or having concerns that we should be intervening on. So the school found it very helpful. There was lots of things that got caught that they were unexpected. The other piece in this is that since the pandemic started, CPS, or the Department of Child and Family Services, has had a 50% less referral rate since the pandemic started, but the type of abuse that they're catching is twice as severe. And the reason for that is school teachers, other people that normally come in contact with these kids that are mandated reporters aren't in contact with these kids. Cameras have been off. It's easy to kind of miss some of the things that you would otherwise notice. And we're having a hard time. How do we connect with them? And so part of this process was catching some of these things and making sure that we had a different view of the students. I think what they found was that it was very successful. So we've done that. We've also trained, I've spent a lot of time training all of the faculty in the different schools. I'm currently working on trying to get some funding together. I lost all my funding to get the Hope Squad built into each of the schools and get a peer-to-peer program going in each of the schools with curriculum, and then that funding kind of went away. So we're now working on a region-wide. So it'd be a 4-county process. So with Okanagan, Grant, Chelan, and Douglas, all schools having access to a peer-to-peer program. So I'm in the middle of working on that. And then we've also done some stuff around messaging. And so I think when you take what they call pro-social messaging, which really says that if I message out and put kind of a message that says, I've had depression, and ever since I've acknowledged that I have depression, I've gotten better, then what happens is other people see that and they go, oh, well, depression treatment works. I'm going to get better, right? So we start using kind of that messaging in all of the things that we start doing, with the idea that, if kids believe people get better, or kids believe you don't have to keep it a secret because other kids haven't kept it a secret and they've been okay, then what happens is it messages and helps them. So we do a lot around that. And then the last thing is that in September, we opened the National Center, or I and a colleague opened the National Center for Suicide Survivors. And that has been, since we opened, it's been almost all kids that we have been dealing with. And it's a treatment that comes out of Europe. It's not available at all. It's called the Attempted Short Intervention Program. And it's in Europe now. It's kind of spreading through Europe, but we're the only outpatient-based clinic that has this model. And it's a video-based therapy that is only for people who have attempted or made a serious attempt, so that they don't go on and reattempt. And it's reduced the amount of reattempts. The other thing that we're doing through that is I'm working with our emergency department to create a pathway to care out of the emergency department, because attempts are up. But what we know is that only 30% of people, parents with kids, will actually enter treatment post-attempt. And out of 30%, only half of those will ever go on to complete. So 15% of people that have made an attempt will have successful treatment. And so the goal of this program is to train parents in suicide prevention, because we know that helps get reattempts down, because they recognize signs and symptoms. The other thing that we're doing is working on the efficacy of how parents feel in a home with a suicidal youth, right? Because the majority of kids don't qualify for inpatient treatment. And many times, even if they do, where do you send them, right? So we have lots of barriers in that way. So in the meantime, until they can go inpatient, they're stuck with the family, but the family doesn't know what to do. And for example, two of the family members that I worked with last week, one of them threatened, said, you just need to stop. If you don't stop, then CPS is going to come in and take you away. Well, what's the message to the kid? Like, okay, I'll just stop, or I'll just pretend like I'm okay until I do something again. And the parents think they're doing the right thing, but they don't understand, like, you can't guilt someone into being better, right? So anyway, so those are all of the kind of the snippets of programs that I've got going on right now. And I also do live trainings on my Facebook page, and try to reach people in different ways that way as well every week.
Awesome. Thanks so much, Dr. Rickard. All right, and then I'm just going to jump to my supervisor, Melissa Tucker, so that she can talk a little bit more about what we are doing with suicide prevention, navigating difficult conversations, and again, a collaborative process on how can we support youth, students, families, teachers, and the community at large.
Hi, thanks, Stephen. I just want to say that I really appreciate all of the panelists coming, and it's been really enlightening for me and informative, and so I hope for everyone else as well. Different panelists have brought up how complex this topic is and how it's so encompassing, and it gets to like all parts of our youth's life. So here at Crisis Connections, our training department is relatively young. We've been around about 3 years, although we have had different programs like our suicide prevention for students, where we go into the classrooms. We have a contract with different cities in King County. So we have been providing that for about 10 years. And we do have a curriculum that we sell that we purchased from an agency in the past. And Joanna mentioned that curriculum. And so we try to always respond to the needs of mostly Washingtonians, but youth. And so we are trying, Stephen and I, to, like he says, to connect different parts of the state and try to be a facilitator of this type of discussion so that we can all see what everyone else is doing and connect with one another. So in that regard, in our department, we are trying to add different elements to kind of help respond to this. So we, of course, had to go onto virtual classroom presentations, which was really challenging, and everyone was very concerned about what does that mean to bring up suicide prevention virtually, like how will teachers and offer that support, you know? So again, like working with Alana, who spoke first, we've just kind of been progressively trying to develop it and make it more robust and more supportive. And in fact, in that regard, myself and the youth trainer, we are going to add more and more topics upstream, you know, to our curriculum. So we have a live presentation that we do, and we've started to onboard a video option on a learning platform for teachers to facilitate that. And then we're going to keep adding to that curriculum so that there will be more social emotional learning units and upstream, because we kind of were like, wow, why are we only waiting until there's such a crisis that somebody feels like they want to, you know, take their life by suicide? So we want to also, like Julie and Joanna and everyone's talking, like intervene a little earlier and try to capture more of that. So hopefully that will be just coming on board as it goes. And we're also trying to, we're in the process of creating online learning modules for parents, because we started to recognize that. So we have Networks for Life, which is a program that we have trainers that are in different school districts that provide that training to school counselors and to teachers, which is like a suicide prevention training that talks about, you know, the OSPI standards and ethics and and all that the things that schools need, but that we were not necessarily reaching a lot of parents. And parents are so integral into supporting their youth, right? And they're very motivated to do it because, of course, these beautiful creatures that they have created, they want to support them and keep them around and keep them happy. So we do do a Networks for Life that we also have for kind of a general population. So a lot of times that does end up capturing parents, but through the Washington State Hospital Association grant, we received some monies to create a parenting program as well that we're kind of looking to, we're developing it with teens themselves. So they're giving us feedback. They're going to be providing some of the content that is in this parent and like non-clinical staff. So maybe like people at nonprofits or teen shelters could also look at it, people that professionals that play a guardian type role, but maybe they're not clinically trained. So we're kind of trying to capture it from a lot of different angles and be responsive to the needs of teachers, of school administrators, of the parents, because for us, of course, the target audience is the students. So whatever the students need or the youth need. I love how Julie was talking about how they're talking to students and they have focus groups and things like that, because again, they're trying to hear from the youth themselves. Like, so what would you really do? What really would be supportive to you? So we are actively working on that. So that will be coming online this year. We have so many projects going on that, yes, it's hard to bring them up like quickly, but as that stuff gets made available, if you're on our mailing list, you'll hear about updates from the training department. You can always check our website. We really want to be invited. Alana was talking about how we are partnering with Federal Way School District. There's other school districts we're in the process of partnering with, like the Renton School District and other areas. So we are looking to, again, try to provide as much support as possible. Of course, I cannot not mention that we have Teen Link, which is a warm peer support line for youth to call and have questions. It doesn't have to be about suicide. It could be any kinds of questions like stress or anxiety or things like that. And we also produce the Where to Turn for Teens, which I hope that everyone has copies available to give to youth that they work with. And if they don't, please reach out to Teen Link or to us, and we will get you copies of this booklet, either through a PDF or actual physical copies. We're happy to deliver them or mail them places, because again, youth can kind of take initiative, or probably even more likely, like Julia was talking about, is when peers can support their peers, right? Because there is that stigma. So if there's a concern about being made fun of or shamed, what we do try to do with training our peer volunteers at Teen Link is to kind of break through that stigma so that they can become supports to other people. So I can remember even when I was in high school, I was the kind of teenager that other teens would come and talk to, and that then I was often facilitating them connecting with somebody else, So those are also really important peers. And I love that the SOS group and Teen Mental Health First Aid are trying to, again, address that. I recently talked to one of the researchers that started working with SOS in the beginning, and now she's working on another kind of upstream project called Gizmo, and she's in Connecticut. So I was connecting with her around, our curriculum and the things that we do in the schools. We were talking about that. And then it also turned out that we started discussing how in Washington, we're very lucky to have a lot of resources actually, because in Connecticut, for example, they don't have mandatory suicide prevention and assessment and intervention training for clinicians or necessarily for teachers or things like that, that we have had success in passing bills in Washington to kind of capture those professionals. I know that I can say that when I was being trained as a clinician, that we didn't, discuss suicide prevention. We didn't discuss in a clinical sense how to help someone who has made attempts, or what to do, with families in the grieving process. And because there's so much to learn, in postgraduate school, that you can't necessarily cover everything, but that through continued education with professionals, school psychologists, other clinicians, that we can, again, sort of prepare ourselves and prevent suicide, and then also work in the recovery process. So I'm very happy that we're all gathered here today and getting a chance to talk a little bit. I don't need to go on and on and on, but I do want to welcome people to reach out to us with either resources available or a need, like a resource need. I will, Stephen and I will serve to try to connect people who are participants with panelists and panelists with participants in a way that is helpful to everyone. And again, we will try to be responsive, and as I mentioned, potentially have a continued discussion around these kinds of topics if there's a need or a desire, because at Crisis Connections, we just really, our main goal is to try to provide as much support and connection around the state to prevent suicide, to prevent crisis, and to help destigmatize mental health issues, behavioral health issues. So thanks so much for participating today, to the panelists and to all the participants. Stephen, I'll hand it back to you. And I am available. I put my email in there. I can put it again. So thanks so much.
All right, so with that said, did anyone have any questions? We did have a couple of panelists who had to step out for other engagements. So did anyone have any questions for any of the remaining panelists we have? We still have Jennifer and Dr. Rickard and Terry. If you have questions for, let's see, Alana or Joanna, we can forward questions to her and either have her reach out to you, or we'll help coordinate in getting you some answers.
I did want to also invite panelists to ask each other questions. I think that can be useful too.
I think the only thing I will share or add is that I just want to make sure that everybody that's on here that came to get something just understands that there's a lot of myths around suicide and suicide prevention, and especially with kids. And I think it's important to just always mention that it's okay to ask direct questions about suicide, because we're not implanting it. If they're already thinking about it, they're already thinking about it. It's kind of like sex education, right? I mean, I think the kids are talking about it. They're behind the scenes talking about misinformation, and it's up to us as the adults to make sure that we provide them with right information. The number one thing that happens at any of my trainings is parents show up with questions about how do my kids respond when someone that they know is suicidal and they're supposed to keep it secret, or they're finding about, worries about someone being suicidal on a social media platform. Like, what's the response? And my response always is to get someone that can help you at the school level, the teacher, the administrators, your parents, if you can, but something that involves death isn't a secret. But at the administrator or the parent or the adult level, it's really recognizing signs that are unique and different from their baseline function, and then just being willing to ask, are you feeling sad, depressed, down? Right now has been really hard. And are you thinking about suicide? Have you ever had those thoughts? Is anybody around you talking about that? And I think it's important that we just look at kind of how do we manage that? Like, what can we do a better job to make sure that those types of conversations are happening? And I know it's uncomfortable, and my gauge always is if it's uncomfortable for me or the adults, then you know it's worse for the kids. So it's really our job to model that type of communication.
Thanks, Julie, for sharing that. I can definitely say that going into the classrooms, I mean, I see the kids most of the time once, but we try to build that rapport right away. And I have been really impressed with how open many kids are, and how they are saying that they're really struggling with a lot, and they're looking for someone to ask them. They really want people to be curious. They want the adults in their life to ask, because when I go in there and I start asking them questions, they open up, you know what I mean? So I know that I'm basically a perfect stranger, and yet because I'm asking, they start to explore that. So like how Alana was saying, after I went to some of the presentations at her school that I was doing, they actually created like a group for those students that were asking a lot of those questions. And it turned out, I think Sheila wouldn't mind if I said this, but it was a lot of the students that didn't have friends. Yeah. And so then they created a group for those folks, and who were, in these remote little boxes. Now all of a sudden they at least had a place for them to build connections and friends with each other. So I won't go on and on, but I appreciate that.
No, and one of the things that came out of our focus group is exactly that the kids said, adults at the school will say, "Are you okay?" And then I'm going to always say, yes. And then what I'm hoping is that they're going to ask, what they said was 3 times, at least 3 times, "Are you okay?" Because by the 3rd time, I figured out that they actually do care, and they don't want the nice answer. Yeah. But when the first few times, I'm testing to see if they can even handle it, and if they keep coming back. And when they finally keep coming back, I will then respond with the truth around that. And I think that's the piece that we as adults fail on. We've got to keep coming back and saying, "Hey, I'm here. It's okay to have that conversation." But what often happens is our voice is saying one thing, but our body language is showing that we're uncomfortable and not okay with that conversation. And I think that's where we get stuck.
Yeah, or not interested, right? We're like, "Oh, are you okay?"
Yeah. Yeah, or our watch is going off, right? And then we're looking away, which shows that I'm not really present with you. I've got other things, so if this isn't going to take long, I'm with you.
Yeah.
And so I think we're stuck in that.
Julie, not just to you, but maybe also to Jennifer or to Terry, but people are interested in how can we get teen focus groups? How can we make that happen? How can we hear what our teens need? How can we gather them somewhere? Do you guys have any suggestions for that?
Well, I can share how we did it. So at the coalition, I have several people. So there's many schools right in our district. And so I have someone from the middle schools as well as the high school. We're in 2 counties. And so it's people from both sides of the river. And we just had them pick, each of the representative was to go back to the school counselors and say, pick 3 kids, 4 kids, however many you want, that are willing to participate. And then they just kind of put it out there. I created a flyer. They handed it out to kids that they thought might be interested. I figured more is better. And what we got was a really good array of kids that were part of student leadership, and the kids that were kind of being bullied and struggling and feeling like they were in all different groups. And then we had a kind of a set way that we met with them. I kind of did a presentation on suicide prevention and the purpose and what we were hoping to gain from them. And man, they gave us so much.
They ran with it, right? That's been our experience too.
Yep.
Is that when we open that door, kind of however you can connect, they run with it.
Yeah.
I think Jennifer and Terry also want to say something. So Jennifer,
I was just going to add that, there was a question in there, does culture matter? And I would say that, I would say yes, that you have to really understand your populations of students and ways that they connect. But I also would say that in addition to that there already are embedded leadership opportunities, like if your high school does Link Crew, for example, if they really follow the protocols for developing Link Crew, which is a leadership development program that's around student engagement, the way that you pick your leaders is to make sure that it's across the board. It meets gender, race, different connections. So embedded a lot of times in schools are already groups of students that are looking for ways to help and to support, and it's in their nature, and they want to share and get involved. And I think during this crisis and this pandemic, I think that our kids are waiting for opportunity to come together and to ask them questions and get them involved. So whether it is already pre-developed groups of students that already exist that want to be leaders, I think that now more than ever, I think that they are waiting for us to ask them what do you think? And I know that I think it is in King County. I wanted to mention Puget Sound ESD. They were really helpful and responsive to me when I was asking for more resources. But what came out of that was there was a BIPOC specific group of students that is just overflowing with students who are also just a place to talk about and discuss what is happening in our country and access there. So I would just say that our kids are waiting. So just ask, organized in any way that you want. They're looking for a platform to connect and share. And in any way, counselors are always a really good resource to gather students together. Our kids are missing out on youth sports, and so they're just literally dying because and are looking for ways to connect.
Thank you. Carrie, did you want to speak at all to getting focus groups together, or?
Yeah, I wanted to share like what we had experienced in this 2020, and that it was in February. We had in one community, we had one death by suicide, and then there were multiple triggers that had caused, like some serious concern. And what we ended up doing is, because I'm one person working this, I'm looking for someone to come in and help me. But what we did is we had the local clinic, we had the local high school, we had some social workers, and we had some mental health or some clinicians. And we also had concerned community members. What we did is we sat down collectively as a group because we had to address this in front of the whole school. And what we decided to do was set up, some presentations, because there's the school that we went into, it's Interim, and that's like 98% Native American students. And we had decided to do a presentation. So we pulled in two guys that are, making their way through the music. They're what are those things? What are those awards called? Academy Award winners on the Native American music stream. And anyway, we pulled them in. I got up a presentation because the individual who died by suicide took his life because of bullying. So I came up with a presentation for bullying, and we had a couple of other folks, people come in and do a presentation. And then we ended up doing a community dinner. So the presentation in the morning went really well. The kids were pretty receptive to it. My son, he's 16, and last year he was accused of being a bully. And in my line of work, I can't have that, especially with my own children, because I just don't think it's right. I went through bullying when I was in high school, and the way I took care of it was with my left hand and my right hand, and business was taken care of and I didn't have to worry about it again. But in today's society, it's a little bit different. You can't behave in that manner. I know it was a little barbaric, but hey, I got it done. So the presentation that I did, because of my son being accused of it, what I did is I made him come up with the statistics about bullying and how it takes place with it, like just all the numbers. And then I also made him identify the different types of bullying that takes place. And there were a couple of other things that we had covered in the presentation. And what I made him do was go before his colleagues and do the presentation. And so what ended up happening at the end of the presentation with my son doing it, the kid that actually called him the bully and the teachers that called him the bully actually came forward and apologized, because the kid that actually, so the kid put himself in a locker and he got claustrophobic and he started to thrash in the closed locker and he couldn't get out. And because of the pressure on the lock, my son couldn't open it, and the coaches walked in. And that's when they had said that Joseph had, my son's name is Joseph, that he had bullied the kid and locked him in the locker. So the kid came forward after the presentation and just said, hey, look, I owe you an apology. I didn't know that had taken place. And so the teachers was like, oh, you didn't do this. So it was a little too late, but apologies were still served. And so I shared this story with the kids over in Interim, and they know my son because my son plays basketball with them and they play football against each other and, things like that. And so the kids kind of tied into it because I felt like I had normalized it by pulling my son into the middle of it because he's the same age. Had I taken the approach that I was the one that did the presentation, I think I would have got less attention. And then when we pulled in the two guys and the other folks, because they're, well known in their own small community, and it's a pretty small, tight niche community, the kids really, really open to it, because majority of the kids at the presentation that we did earlier in the day ended up coming to the community dinner as well. So our community dinner was to reach out to the parents and the community members to see what it is that we can do to better assist them. So it was kind of like a focus group. And what we ended up doing is we served the dinner, and then we ended up breaking up into like 5 different groups. And it was kind of cool because in these different groups, the one that I facilitated, I had a couple of students in there and a couple of law enforcement guys came over, and I had a couple of elder community members. And it was absolutely fantastic because these guys ended up sharing some really, really good information. And the ones that were in my group happened to be all men. I don't know why, but all of them just kind of sort of gravitated towards me, and sort of the students. And what we found out about from our students is that, yeah, they didn't have any friends, so that it became more of an isolation for them. And then in that isolation, their mind just kind of sort of started to roam. And the ideations had started to creep into this. And then the law enforcement guys kind of stepped in, and they were telling their sides of how it works, but what would be best for them. And I think Julia was the one that suggested this, and it was a good suggestion, and I had brought it forward, and we're looking into ways of how we might be able to incorporate this. But bring a clinician, hire a clinician on within the PD, and take the clinicians on the suicide event calls. We're trying to budget it, and we're trying to get it in there, and we're trying to get people interested in it. We're struggling a little bit because it's been a couple of years since I've talked to Julie, and but we're making our way with it. And then the elders amongst tribal members are pretty important. What we try to do is we always try to make sure that when an elder is speaking, we give the utmost respect. When they're giving suggestions, you take that and you allow it to be for what it is, and or take what it is that you got from that elder and incorporate it into your daily life. We do have an elders group up here also. They go specifically in this event that I'm talking about that happened in February in 2020. We had some elders there as well, and they came from our elder circle. And so what they do is that they come in and they help us out with, if the kids don't want to go to a clinician, or if the young adult doesn't want to go to a clinician, then this is where the elder groups come in and they help. It could be either from a curriculum, it could be from a traditional aspect, it could be, just learning how to do something. If the kid is interested in doing, like our power dances. So what the elder would do is help them set up and make in regalia, the different types the different dances. So we have a traditional, we have a fancy, we have jingle, those different dances. And so the elder would help this student from the beginning until they are actually welcome into the powwow society. And once they're done with getting the welcoming, then there's that constant follow-up. So that's what our elder group does, and it's pretty cool. I can definitely appreciate what those folks do, and they've really helped me out, to be honest with you. So on that day, those are some of the resources that we tapped into. We also tapped into some state clinicians, because the community is so small and our clinic is really small. We don't have the resources available to help us. And this was such a big event because of the young person that had died by suicide, triggered a lot of suicide ideations and behaviors. So we had to scramble, and it was a pretty big group, but we were able to minimize it and then get the kids back on track and get them focused back on school and what their extracurricular activities were. So that was really helpful. Talking about our elders, we have our business council. We have a couple of folks on there that are elders, and specifically there's one here in the Omak area. Here just recently, we had a veteran. I don't know where to help out or tap into veteran support groups here within the Okanagan County. I'm still trying to get that figured out. And it's really not that hard, but I have other things that I have to do for my grant, unfortunately. But this young man had serious ideation. He is PSTD. He drinks alcohol and he does drugs. So he was under the influence when this all had taken place, and his aunt had contacted me and said, "Hey, I need help." And I went, okay. So I initiated the calls to get this young man in to get help. But what this elder did, she also contacted him, and he directly showed up at this person's house and had talked to him. And so that's the impact that our elders have on our young adults and our youth, because and so now I'm going to kind of tell you a little bit of a side story here. When I was doing my graduate program and I was writing my final paper, I did my research was on the gap, and I called it the gap because there's a gap between our elders and our youth with education. And in doing this research, I had put out a survey amongst the Quinault Indian Nation. I'm Colville, and my husband and my children are Quinault, and we were living over there while I was doing my education. And 84%, one of my questions was, are you a grandparent raising your grandchildren? 84% of the Quinault tribal members that had participated in my survey, and there was over 200, 84% of these folks are elders raising their grandkids. Mm-hmm. And so we have a big gap here because the elders don't understand the education system, because a lot of them are dropouts. Our elders are working in the field. They're still having to work today because they're raising their grandchildren. So there's a lot that ties into that. And so coming back to where I'm at, this is what I'm talking about. Our elders are such a precious resource amongst us, because not only are they raising their grandchildren, but they're also helping out you know, the communities when there is a death by suicide or whatever the event may be, they definitely step in and help out. So that's what I wanted to share, and I hope it's helpful.
Thank you, Terry. That was helpful. I think it's important to be creative when you're entering this field. Jennifer and Julie and Terry, I think, are real leaders in showing that creativity is what we need to bring to this complex topic so that we can, you know, again, reduce stress, anxiety, suicide, stigma, working together.
All right, so I just want to again thank everyone that is still here. A big thank you to our panelists, Jennifer, Julie, Terry, Joanna, and Alana, for providing what they are doing, as well as how we can continue to support one another. You know, our name is Crisis Connections, and we might not be in your county, but Melissa and I want to be resources for you all in the work that we're doing, as well as maybe even to connect you to even the local resources in your area. I want to again acknowledge the Washington State Hospital Association, because they are our funders who helped us to provide this webinar free of charge. It will live on our YouTube channel, so you could watch it in the future. You can share this with parents, other adults, other staff in the school, anyone that you're working with that is just trying to maybe dip their toe in learning about suicide prevention. One of the things that I'll mention before we go is that Melissa and I have been talking about what is suicide prevention? Why do we talk about suicide prevention at the end when someone dies by suicide, when someone's having thoughts of suicide, versus we can do prevention at different levels, at the stress level, at the distress level, at the depressed level. There are so many levels that we could work with in prevention. Yes, we want to be direct. Are you thinking about suicide? Are you thinking about killing yourself? Yes, we want to be prepared. Again, as a social worker, with my master's degree, with my training in assist, before I came into Crisis Connections, I was scared to ask the question. It wasn't until I came here at Crisis Connections, I got more training, I go out and train. I have asked friends and family members myself if they had thoughts about suicide or killing themselves. And yes, it's still scary. Yes, it's still uncomfortable, but it's so important because it opens the door for the other person to get some sense of relief that they're not isolated, they're not alone, and someone is willing to be a part of that support network. So again, I thank you all for being here. If you have any other additional questions, please feel free to email Melissa and I. Again, intentionally remember to breathe, relax, pay attention to what's happening in your bodies, and again, take care of yourselves.
Thank you, Stephen.